Hey everyone, I'm Ken and welcome to Ken English Corner. Here we only feed you with positive achievement humanity made. Today we're looking at a massive victory in West Africa, Niger. This is a powerful story. And it's also a great way for you to practice your English and learn some high level vocabulary. Trip to Niger for the details.
This green expanse along the Niger, Tapoa, and Serba rivers contains some of the most fertile land in West Africa. But for centuries, these basins were a trap. To live near these waters and farm this soil was to accept a near guarantee of eventual blindness. The cause is onchocerciasis, a parasitic worm transmitted through the repeated bites of the black fly.
Now pay attention to this next word because it's very common in science news.
The black fly is the primary vector, the organism that carries and transmits the parasite. These flies only breed in fast-flowing, oxygen-rich river rapids. This specific requirement made the disease endemic to these basins, meaning it was regularly found and strictly restricted to these water sources. The
It's a terrifying process. Inside the body, those larvae matures and create an unbearable itching. They cause different skin conditions too. But as we will explain, the final stage is where the tragedy really hits.
the final stage occurs when the parasites reach the eyes. The resulting inflammation leads to total, irreversible blindness, turning the river's gift of fertile land into a source of permanent darkness. The fear of the fly eventually drove entire communities to make a desperate choice: stay by the water and lose their sight, or abandon the most productive land they owned. They fled to the arid, less productive highlands to survive.
Imagine that choice, sight or survival. Because of that choice, the valleys became ghost towns. Fertile valleys abandoned, and for the people who stayed, it created a heartbreaking crisis. For the children, the caregivers became the ones in need.
This forced a devastating shift in the labor force. Young children, mostly girls, were pulled out of school to serve as human guide sticks, spending their childhoods leading their blinded elders through the village. River blindness became more than a medical condition. It was a multi-generational trap, a trap of profound poverty, of forced illiteracy, and of severe social stigma, isolating victims from their own communities.
But here is where the good news starts. In the late 70s and 80s, we saw a massive turning point with the onchocerciasis control program.
A major turning point finally arrived in 1987 when the pharmaceutical company Merck developed ivermectin, known by the brand name Mectizin. Merck pledged to donate the medication for as much as needed for as long as needed, providing the biological tool necessary to stop the parasite's life cycle. However, the donation only solved half the problem.
This is a key point for our English learners. Solving the problem is one thing, but the logistic, the actual delivery is another. Look at this description of the logistical reality.
Millions of pills are only effective if they can reach the thousands of isolated, roadless villages where the refugees actually lived. Traditional medical models, which rely on doctors and clinics, couldn't bridge this final gap. Reaching the most remote patients required a total shift in how healthcare was delivered.
This is my favorite part of the story. Instead of doctors, the people themselves took charge.
Niger adopted a strategy called community-directed treatment. Instead of waiting for doctors, the program empowered local volunteers to distribute the medication directly to their neighbors and families. These workers had to be relentless, meaning they maintained a constant, never-stopping cycle of distribution year after year for 50 years to ensure the parasite could not return. To reach the most isolated residents, volunteers traveled on foot and by bicycle through vast dry brush, ensuring that no village, no matter how remote, was missed during the annual distribution. This approach effectively turned the communities most affected by the disease into the very army that would defeat it. While the global laboratories provided the vital medicine, it was the persistent willpower of local citizens that allowed Niger to finally break the cycle of infection. Niger.
Relentless. This is a great word for your vocabulary. It means they never give up. And because they didn't give up, we reached a historic milestone on January 13, 2025.
On January 30, 2025, the World Health Organization officially verified that Niger had achieved the elimination of river blindness. This was not a matter of managing the disease or reducing the numbers. After 5 decades of effort, the parasite had been entirely wiped out within the country's borders. This milestone allowed for a historic return to the river. Families abandoned the arid highlands and moved back down into the lush, fertile valleys of the Niger, Topoa, and Serba rivers.
This is the best news of all. The ghost towns are coming back to life. They are thriving. And those young girls we mentioned earlier, their lives have changed forever. This
The
is
abandoned valleys have been resurrected into bustling economic hubs. The caregiver crisis has ended. The young girls who once served as guide sticks have left the dirt paths and returned to where they belong, the classroom.
what a powerful lesson in what happens when international help meets local willpower. I hope this story inspired you today and helped you pick up some new English phrases. To master the vocabulary from this case study and see how Niger reclaimed the river, head over to Ken's English Corner for the full study guide. I'm Ken, and I will see you in the next lesson.